For years, many families in Kakamega County have only discovered sickle cell disease after repeated illness, severe pain, and sometimes death. In Chibanga village in Matungu sub-county, Sella Shitoti knows that pain too well.
Kuna siku ya crisis ilianza na ikaanza kwa wote. Mmoja akaanza na mgongo. Kwanza sana huyo mkubwa. Ikaanza na mgongo. Bado na jaribu venye kumshughulikia, mwingine naye akaanza na mkono. Sasa ikabidi nibebe wote nifanye nini? Nikimbie nao hospitali. Venye nilikuwa ninaenda hospitali, napigiwa simu tena mjukuu nyumbani amefanya nini? Ameshindwa. Sasa nikawaambia tu wamlete wote nikae nao hospitali. Venye nilifika hospitali wakalazwa wote safari moja.
Out of her 6 children, 3 are living with sickle cell disease. Another child who also had the condition died at the age of 9.
Alikufa kama ashamuongeza damu mara ngapi? Mara 2. Ya 3 nikadhania pengine ataamuka lakini hakuamka, akaenda hivyo.
She says she only learned about her children's condition when the disease had already advanced. By then, the warning signs had become impossible to ignore: repeated illness, pain crises, and repeated admissions to hospital. Today, Sella says she cannot help but wonder what might have happened if the disease had been detected at birth.
Angeanza matibabu mapema. Hata huyo mwenye alikufa angekufa. Angekufa.
That is the hope now driving a new program in Kakamega County, screening newborn babies for sickle cell disease before the symptoms begin to show. For years, one of the biggest problems in fight against sickle cell disease in Western Kenya has been late diagnosis. By the time many families discover the disease, a child may have already gone through repeated crises, infections, severe anemia, or blood transfusion. The program is being rolled out through a partnership between Kakamega County Government, Masinde Muliro University of Science and Technology, and DAMCA, an organization that has been supporting children living with sickle cell disease and their families.
Many children are lost because diagnosis came too late. Today we are changing that story.
Caroline Mabunde, the founder and director of DAMCA, says the screening is completely free of charge and available to mothers who deliver in hospitals.
This is truly a game changer for Kakamega County, and I know the entire nation, because then we stand as the first county to initiate a newborn screening in our facilities, completely free of charge, whether registered by SHA or not. Screening is free of charge.
Dr. Beatrice Mukabana of Masinde Muliro University and the principal investigator in the project says the screening will not only help identify newborns living with the disease, but also generate data that can guide future planning, including possible testing of expectant mothers.
And now we want to find out what we have been saying and claiming that Kakamega has the numbers. Is it really true? That's why now we are testing, and we are going to analyze the data at the end of it all and find out if it is the burden. How is it? Is it really true that we have it? So we are basically carrying out the research, and apart from just the testing and finding out the burden, we are also conducting the community to find out what their gaps are, so that we can embark on that when we are teaching.
This is an opportunity that no mother should miss. We are already seeing very many cases in Kakamega County, and we want to be sure about the index numbers. What are we talking about? So that it also supports the county government to make informed decisions based on the data that we shall collect.
At Matungu Sub-County Hospital, 21-year-old Rispa Omoseve and Umi Auma are among the first young mothers whose 3-day-old babies have been tested for sickle cell disease following the launch.
Nimefurahia kufanyia mtoto test. Sijaisikia, ndio nimesikia tu leo. Na hana chembe za sickle cell. Nilifurahi kwa sababu watu husema ya kwamba ati mtoto mwenye ako na sickle cell haizifikisha 18 years.
And the early data is already raising concern. According to the project data clerk, Noah Mkoya, Matungu is leading among the 4 facilities involved so far.
We have been able to screen about 185 so far. most of them come from Matungu in two ways. Those screened at Matungu level 4 and then those screened in other facilities. We have had cases in Mumias, but looking at their residents, they still come from Matungu. So Matungu accounts for 19% so far of the cases we have screened.
County health officials led by CEC Livingston Imbai says long-term plan is to expand the program beyond the current pilot sites. Kakamega County has 202 public health facilities. For now, screening has started in 4, with plans already underway for wider rollout.
It is estimated that up to 90% of the affected children die before the age of 5 years, usually due to late diagnosis. So you can imagine the people that we have lost because we never used to carry diagnosis on time.
Chief Officer for Health, Rose Mohanda, says the success of the program will not only depend on hospitals, but also on community health promoters who will be expected to identify pregnant women in villages and encourage them to deliver in health facilities where newborn screening can be done immediately after birth.
And the first intervention is the antenatal clinic. The next intervention, we want all our women to deliver in our hospitals so that we can also access the service we are launching today.
And as the county strengthens newborn screening, it is also stepping up community blood donation drive, a crucial part of care for many children who develop severe complications and need transfusion.
In our budget, we are planning for outreaches where we can ask the public to come and donate blood so that our blood bank can have enough blood.
For mothers living maternity wards today with screened babies in their arms, the test may seem small, but for families that have buried children, sold property for treatment, or moved from one hospital to another searching for answers, it could mean everything. Because in the fight against sickle cell disease, early diagnosis can mean early treatment, early counseling, early support, and sometimes the chance to save a child before the illness begins to take hold. This screening gives families here a chance to know in time, act in time, and keep more children alive.